If you're over 60, this could be the most important health video you watch all year because something you do every year, maybe even every few months, could be silently putting your brain in danger. As a brain doctor, I'm shocked by what I see in my clinic. Seniors, smart, cautious, well meaning, coming in for a simple checkup and leaving with a diagnosis that changed everything. You're getting these tests, believing they protect you. But the truth, after 70, certain medical checkups may increase your risk of stroke, cognitive decline, even unnecessary surgery. And the scariest part, you're taking this risk without even knowing it. You're following the rules, booking the appointments, showing up early, fasting, doing everything right. But these standard tests weren't designed for someone your age. Your brain, your blood vessels, your metabolism, they've changed. And what once helped may now harm. And you need to stop it today before it's too late. After 30 years as a brain doctor, what I've seen in stroke patients shocked me. I've watched vibrant, independent adults lose their memory, their balance, their ability to live alone, all because of a test they were told was routine. Today, I'll walk you through 5 common checkups that may be doing more harm than good after age 70. I'll explain who's at risk, what to avoid, and what to do instead, so you stay safe, smart, and in control of your care. Before we dive in, leave a comment. Where are you watching from? How old are you? Have you ever felt unsure after a medical test or procedure? And please watch until the end. I'll share something most doctors never say out loud, but every senior needs to hear. Number 1, bone density scan. When strong bones become a weak choice. It sounds so simple, doesn't it? A bone density scan. Quick, painless, no needles, no fasting. Just lie down, breathe normally, and walk out knowing whether your bones are strong or weak. But here's what no one tells you once you're over 70. This very scan, officially called a DEXA scan, could be the first step in a cascade of fear, side effects, and even permanent complications. Let me explain why. As we age, it's natural for our bones to lose some density, just like we lose a bit of muscle, flexibility, or skin elasticity. It's not always a disease. It's part of the aging process. But when a scan shows even a small dip in bone mass, many seniors are labeled with osteopenia or mild osteoporosis, terms that sound serious but don't always mean you're at high risk for a fracture. Unfortunately, that label can quickly turn into a prescription. And that's where the danger begins. Many older adults are started on medications like bisphosphonates, drugs meant to strengthen bones. But what these pills often do is harden bone structure without improving flexibility or resilience. That can lead to brittle bones that crack in unusual ways. Even worse, side effects include esophageal irritation, stomach inflammation, and a rare but devastating condition called jaw osteonecrosis, where part of the jawbone begins to die. Let me share a story that still haunts me. Rose, a 76-year-old retired piano teacher, was full of life. She walked daily, never had a fall, never complained of pain. During a routine physical, her doctor recommended a DEXA scan. The result? Osteopenia. Nothing serious. But she was immediately started on alendronate, a common bone drug. Within weeks, she developed painful acid reflux. Then came the jaw pain. She stopped eating crunchy foods. She stopped singing in her church choir. And then, heartbreakingly, she stopped playing piano. When Rose came to my clinic, I asked her one question. Have you ever broken a bone in your life? She shook her head. Never, she said. We took her off the medication. Instead, we built her a plan rooted in food, movement, and sunlight. She added more leafy greens and sardines to her diet for natural calcium. She joined a gentle resistance band group at her community center. She took vitamin D in the morning, and only at the safe dose her lab supported. 12 months later, she wasn't just pain-free, she was back to performing at local recitals, proud, confident, and stronger than ever. And guess what? Still no fractures. You see, the problem isn't the scan, it's how we react to it. A number on a screen doesn't always mean danger, but fear, that can lead to decisions that do more harm than help. According to a 2022 study in Osteoporosis International, simple lifestyle interventions like vitamin D, protein intake, balance exercises, and strength training reduce fracture risk by more than 20% in older adults. And they come without the side effects of medication. So here's what I want every senior to hear. If you're over 70, haven't had any falls or fractures, and are active and mobile, think twice before starting bone medication just because of a scan. Ask your doctor, what does this result truly mean for me? What's the actual benefit of treatment at my age? Are there natural, safer alternatives? And always remember, bone strength isn't just about density, it's about coordination, balance, and muscle support. You don't just need harder bones. You need a body that moves well and a lifestyle that supports bone health from the inside out. Because at this age, your goal isn't to fix numbers, it's to protect your independence. And that means choosing interventions that strengthen your life, not weaken it with fear or side effects. Now, if you thought a bone scan was overused, wait until you hear about a test that's far more common and far more dangerous when misused, the brain MRI. Let's talk about what happens when memory fears send seniors into a scanner. Number 2, brain MRI for memory loss. When clarity becomes confusion. Let's be honest, forgetting names, misplacing your keys, walking into a room and forgetting why. These things happen. And for most people over 70, they're normal. But the fear that comes with them, that fear can be overwhelming. Is it dementia? Is this how it starts? Am I losing my mind? Naturally, when seniors mention memory lapses to their doctor, the response is often, let's get a brain MRI to be sure. And that sounds reasonable, right? A brain scan to look for problems. What could go wrong? The answer? A lot. You see, MRIs are incredibly detailed. They're designed to pick up every little change in your brain tissue. But here's what most doctors don't tell you. After 70, nearly everyone's brain shows some degree of shrinkage, white matter changes, or small vessel signs. These are normal signs of aging, not disease. But when they show up on a scan, they can look scary. And suddenly, the spiral begins. Let me share the story of George, a 74-year-old retired engineer who lived a structured life. He kept a journal, paid bills on time, and still enjoyed doing crossword puzzles every morning. But over time, he noticed he was forgetting names more often. He got nervous and mentioned it to his doctor. That led to a brain MRI. The scan showed white matter changes, a term that sounds ominous, but simply reflects small aging-related changes in the brain's wiring. George panicked. He convinced himself he had early Alzheimer's. He stopped driving. He declined social invitations. He even began preparing his will more urgently. But here's the heartbreaking part. When we tested his cognition using a standard memory screening tool, his score was normal. There was no dementia, no Alzheimer's, just age. The scan didn't explain his forgetfulness. It amplified his fear. And he's not alone. In a 2021 study published in Neurology Today, over 3,000 MRIs were reviewed from adults aged 70 to 85 who had mild memory concerns. 86% of scans showed some type of abnormality, but only 3% of those findings led to meaningful treatment. The rest? They triggered unnecessary referrals, spinal taps, and even surgeries. Yes, surgeries, brain biopsies based on findings that were often irrelevant or benign. And the emotional toll? Devastating. Anxiety, isolation, self-doubt, all from a scan that didn't help and may have done real harm. So, what should you do if you're noticing changes in memory? The first step is not a scan, it's a simple cognitive screening test. These are paper based, non invasive, and take just 10 to 15 minutes. They evaluate memory, language, attention, and executive function, giving a clear picture of brain performance without radiation, anxiety, or invasive procedures. Even more importantly, many cases of memory changes are linked to reversible causes: dehydration, sleep issues, medication side effects, vitamin B12 deficiency, hearing loss. These are all manageable, and none of them show up on an MRI. So if you're feeling more forgetful, don't jump into the MRI machine. Instead, start with hydration, 8 to 10 cups of water daily, consistent quality sleep, physical movement, walking, light stretching, mentally stimulating activities, games, puzzles, learning. Routine memory screenings with your primary care provider. Only if you experience red flag symptoms like sudden personality changes, seizures, rapid functional decline, or neurological events like loss of balance should imaging be considered. Because what your brain needs at this age isn't fear, it's support, it's care, it's context. George eventually returned to his morning walks and his puzzles. With education and reassurance, he reclaimed his confidence. No scan could have done that, but understanding his brain, accepting the changes, and staying engaged, that saved his quality of life. So next time someone says, let's just get a scan to be sure, ask instead, what happens next if it shows something? And more importantly, what's the best way to help my brain today? Now, if that surprised you, wait until we look at the next checkup, a test done to catch heart disease early. But after 70, it may send you into the OR for surgery you didn't need. Let's talk about the cardiac stress test. Number 3, cardiac stress test. When tiredness isn't a heart attack, you're 73, maybe 75. You feel a little more tired walking up a hill or carrying groceries. Your doctor listens carefully, nods, then says, let's schedule a stress test just to be safe. It sounds responsible, even life-saving. But for many seniors, especially those without classic heart symptoms, this test may do more harm than good. Let's walk through what a cardiac stress test is. There are 2 main types. One is where you walk on a treadmill while hooked up to monitors. The other uses medication to make your heart beat faster, simulating the effect of exercise. The goal is to see if your heart shows signs of blocked arteries. That sounds smart, except after age 70, the test's accuracy starts to break down. Studies show that for older adults, especially those without chest pain or real exercise limitations, stress tests are far more likely to show a false positive. That means the test says there's a problem when there isn't one. And what follows that false alarm? Often a trip to the cath lab. A cardiac catheterization is an invasive test where doctors insert a small tube into your arteries to take a closer look at your heart's blood vessels. If they find even mild narrowing, which can be normal in aging, they may place a stent or recommend bypass surgery. But here's what many seniors aren't told. Those procedures don't always improve survival or even symptoms in people without clear signs of heart disease. A large study published in the Journal of the American Medical Association in 2017 found that over half of stents placed after stress test referrals were done in patients who didn't truly need them. They didn't live longer. They didn't feel better. But what they did experience were complications: bleeding, kidney problems from the contrast dye, prolonged hospital stays, in some cases strokes or infections, all because of a test that wasn't necessary. Let me share a story that still weighs on me. Raymond was a 75-year-old retired mailman. He walked nearly every day, had no history of heart disease, but mentioned to his doctor that he got tired more easily on steep hills. Just to be sure, his doctor ordered a stress test. The results were unclear, so he was sent for a catheterization. A small blockage was found, and a stent was placed. But that night, Raymond developed a reaction to the dye used during the procedure. His kidneys began to fail. He spent 6 days in the hospital, missed 2 family birthdays, and needed weeks of follow-up care. And the worst part? His fatigue never changed. It turns out he was simply dehydrated and low on magnesium. He didn't need a stent. He needed more rest and better nutrition. That's not to say stress tests are always wrong. If you have real symptoms, chest pain when walking, shortness of breath during mild activity, or sudden drops in stamina, then yes, further testing makes sense. But if you're simply feeling a little slower with age, there are safer, more accurate options to consider first. A resting electrocardiogram, or EKG, can look at your heart's rhythm while you're sitting still. It's fast, painless, and often all that's needed to rule out major issues. Another option is a coronary calcium scan. This is a low radiation imaging test that checks for dangerous plaque buildup in your arteries. It's far less invasive and doesn't push you toward unnecessary procedures. Here's what I always tell my patients. Feeling tired doesn't always mean you're sick. It could mean you're sleep deprived. It could mean you're low on electrolytes. It could mean your meals aren't giving your body what it needs. At 70 or 80, your heart has already carried you through decades of life. It deserves care, but it also deserves protection from overtesting. So before you agree to a stress test, ask these questions. What symptoms are we looking to explain? If the test finds something, what will we do next? And most importantly, will that next step improve my life? Because once you're on the path of heart testing, it's hard to stop. And sometimes the cost is more than just financial. It's physical, emotional, even spiritual. Your independence matters. Your peace of mind matters. Let's protect both by testing with wisdom, not fear. Now, speaking of fear, the next test may surprise you. It's one nearly every senior has had or has been told to schedule. But after age 70, it can cause more complications than it prevents. Let's talk about the colonoscopy and what you truly need to know. Number 4, colonoscopy. When screening turns into surgery. If you're over 70, there's a high chance your doctor has told you to schedule a colonoscopy. Maybe it was during your annual physical, or maybe it was just something you were told to do, because that's what you're supposed to do at your age. But here's a truth that few older adults hear. After 70, and especially after 75, the risks of this routine test can quietly outweigh the benefits. A colonoscopy is a procedure that uses a long, flexible camera to examine the inside of your colon for growths or polyps that could turn into cancer. When used appropriately, it can be life-saving. But for seniors without symptoms, the risk to benefit ratio begins to shift, and not in your favor. Let me explain why. First, there's the prep. Anyone who's had a colonoscopy knows the night before is far from easy. You drink a powerful laxative solution that flushes your system. But for older adults, that flushing can lead to severe dehydration, electrolyte imbalances, and even fainting. Your kidneys, already more fragile with age, can become strained. And for those on blood pressure medications or diuretics, it's even riskier. Then comes the sedation. Colonoscopies are typically done under twilight sedation, a light anesthesia that helps you sleep through the procedure. But in people over 70, sedation isn't always gentle. It can trigger confusion, delirium, and even long-term cognitive issues. Studies have shown that seniors sedated for colonoscopy are more likely to suffer from memory lapses and balance problems for weeks afterward. And let's not forget the procedure itself. While rare, complications like bleeding, tearing of the colon wall, or irregular heart rhythms can occur. A 2019 study published in JAMA Internal Medicine looked at over 1.3 million Medicare patients aged 70 and older. The findings were startling. For every 1,000 colonoscopies performed on patients over 75, only 2 lives were saved, but more than 20 experienced serious complications. That's a 10-to-1 risk to benefit ratio. Let me tell you about Dana, a 73-year-old grandmother who ran a small bakery with her daughter. She had no symptoms, no changes in bowel habits, no family history of colon cancer, but her new primary doctor urged her to get a screening colonoscopy just to be safe. During the procedure, they removed a small harmless polyp, but that evening, Dana felt intense abdominal pain and passed out in her kitchen. She was rushed to the hospital. Doctors found a small perforation, meaning the colon wall had been torn. She spent 9 days in recovery, lost significant weight, and struggled with fatigue for months. Worst of all, she didn't need the test in the first place. When we reviewed her case, we discovered she'd already had 2 clean colonoscopies earlier in life. According to national guidelines, there was no need to repeat it. That brings us to an important point. The U.S. Preventive Services Task Force currently recommends stopping routine colon cancer screening at age 75 for most people. The older you get, the less likely you are to benefit, and the more likely you are to suffer harm. Now, does that mean you should ignore your colon completely? Of course not. But there are better alternatives for seniors. One of the best options is the FET test, a simple at-home stool test that checks for hidden blood in your stool. No prep, no sedation, no risk. It can be done annually and is quite accurate in spotting early signs of cancer, especially when repeated over time. If it comes back abnormal, then, and only then, should a colonoscopy be considered. So if you're healthy, symptom-free, and past 70, ask your doctor, do I need this test? What will change if the result is normal? Is there a safer way to screen my colon? Because once you go down the colonoscopy path, it's hard to step off. You get one, then they find something small, and suddenly you're on a schedule of repeat procedures that may never have been necessary to begin with. Remember this, prevention isn't just about catching disease. It's about protecting your body from unnecessary harm. And for many older adults, protecting your colon means saying no to a risky procedure and yes to smarter, safer alternatives. Now, if this one caught you off guard, wait until you hear about the most dangerous test on our list. It's often offered as part of an executive checkup or wellness package, and while it promises peace of mind, it could quietly raise your risk of cancer more than it reduces it. Let's talk about the full body CT scan and why it may be the most harmful test a healthy senior can take. Number 5, full body CT scan, the most dangerous test you never needed. It sounds so modern, so proactive. A full body CT scan offered at private clinics or luxury wellness centers promises to scan every inch of your body, your chest, abdomen, pelvis, even your brain, to catch disease before it starts. But for older adults, especially those over 70, this test may not be a gift. It may be a ticking time bomb. Let's start with what a CT scan is. CT, or computed tomography, uses X-ray technology to take hundreds of cross-sectional images of your body. When used for specific problems, like a suspected stroke, serious infection, or known tumor, it can be incredibly helpful. But when used to screen the whole body in people who feel fine, the story changes dramatically. First, the radiation. A single full-body CT scan can expose you to 10 to 20 millisieverts of ionizing radiation. That's the equivalent of 500 chest x-rays. Let me say that again, 500. This is not a small dose. And radiation, especially repeated exposure, is a known cause of cancer. A 2023 modeling study published in JAMA Internal Medicine revealed something shocking. The growing use of CT scans in the United States may now be responsible for up to 5% of all cancers. That puts it on par with daily alcohol consumption as a cancer risk factor. Now here's the cruel twist. These scans often find things, Small cysts, nodules, calcium deposits that are completely harmless. They're just part of aging. But once they're found, the medical system kicks in. You get called back for more imaging, then a biopsy, sometimes even surgery. Let me introduce you to Marcus. He was 80, a retired martial arts instructor who led fitness classes for seniors. He felt great, had no major health problems, and signed up for a premium senior elite checkup at a private clinic. It included a full body CT scan. The scan showed a tiny nodule in his lung, just 3 millimeters long. His doctor couldn't say whether it was dangerous or not, so he was sent for a PET scan, which looked a little suspicious. Next came a needle biopsy, a procedure where a needle is inserted into the lung to remove tissue for testing. The biopsy result? Benign. It was nothing. But during the procedure, part of Marcus's lung collapsed. He was hospitalized, put on oxygen, and took 2 months to fully recover, all because of a nodule that would never have harmed him. Sadly, his story isn't unique. This is called the cascade effect. A small finding leads to more tests, which lead to procedures, which lead to complications. And many of these scans never save a life. They just stir up anxiety and harm. That's why organizations like the American College of Radiology, the FDA, and even the American Cancer Society do not recommend full-body CT scans for people without symptoms. Not because the technology is bad, but because the risk of overdiagnosis and overtreatment is too high. Now, I'm not saying ignore your body. If you're experiencing real symptoms, unexplained weight loss, coughing up blood, new pain that won't go away, then yes, targeted scans can be essential. But the key word here is targeted. Not everything, not everywhere, not just because. And if your doctor or clinic recommends a full body scan, ask this: what exactly are we looking for? What will we do if we find something? What are the chances that finding will truly help me? Because once you open the door to full body screening, it's hard to close it. Every tiny shadow, every mild abnormality becomes a question mark. And those question marks can become biopsies, surgeries, and complications that change your life. So here's the wiser approach. Listen to your body. Check in with how you feel. Keep up with your regular primary care visits, where exams and lab tests are based on your health history, not your fears. Focus on proven low-risk ways to stay well. Movement, good sleep, whole foods, social connection, and mental stimulation. You've earned this stage of life. You deserve clarity, not confusion. Peace, not panic. And health, not endless tests that leave you more worried than well. Now that you know which checkups may harm more than help after 70, the question becomes, how can you protect your brain, your heart, and your body without fear, without overtesting? The answer is simpler than most think. Real protection starts with how you live, not how often you get scanned. So let's pause. Let's take this moment to breathe, reflect, and shift the focus. Instead of chasing problems, why not support your body to prevent them? Drink water, breathe fresh air, laugh with someone you love, and never underestimate the power of one small habit done every day. And speaking of small habits, did you know there's a simple 1-minute movement that can help bring back your memory? It's gentle, it's free, and it has helped many of my older patients feel sharp again, mentally and emotionally. I'll walk you through it in the next video, but before you go, tell us in the comments, have you ever had a medical test that left you feeling worse, not better? What did you learn from it? Your story may help someone else avoid the same mistake. And if this video helped you feel more in control, type the number 1 in the comments below. If you feel we can do better, type 0 and tell us why. We are here to listen. Please share this with someone over 60. It might save them from unnecessary harm and guide them toward real health. And don't forget to subscribe. We'll continue sharing what most doctors won't. Truthful, compassionate advice to help you stay strong and independent. See you in the next video. Until then, take care of your mind, your heart, and your hope.